I returned to Regenexx Cayman Islands for another treatment. This time it was a much higher dose of stem cells injected into my discs. In the bottom L5S1 disc, I received 17.5 million stem cells. In the second from the bottom yellow circle there, my T12L1 disc, also 17.5 million stem cells. And then in the top yellow circle there, the T11T12 disc, I received 20x super concentrated plasma. These are the 3 discs that I had treated previously for my last treatment there, where I had 1 million stem cells injected into each disc, as well as I did a 4th disc last time, and then other locations, ligaments and muscles and facet joints. They're cultured stem cells last time and this time, but last time we had additional cultured stem cells readily available banked, so it was a much quicker process where the cells were already ready. So I just had to get my blood drawn so that the PRP could be used as a vessel for the cells. And additional PRP blood was drawn for my left knee. So here is a image of my L5S1 being injected with the stem cells from this latest procedure. This appears to be just another view of the same location being injected. And I have a few other images from the actual procedure here. The next image, you can actually see the 4 facet joints being injected bilateral. So this would be the T12L1 and L1L2 facet joints. You can see one of disc being injected here, and the horizontal line would be the contrast flow being injected into the disc. And then here you can see a shot of my left knee being injected into the ACL with platelet-rich plasma. And it was high-dose PRP injected into my left knee into multiple locations. And then here is just another image showing that my left knee, the right knee in the photo, is very swollen immediately following the procedure. Here I've laid out the locations. So those first 2 discs, L5S1 and T12L1, each had 17.5 million stem cells injected. T11T12 had 20x SCP, super concentrated plasma injected. 1 million stem cells were injected, distributed between my 3 epidural space locations behind those 3 discs, along with the facet joints bilateral at T12L1, L1, L2, L4, L5, and L5S1. The QL quadratus lumborum muscle, the attachments into the lower ribs were injected, as well as my supraspinous ligaments, transverse ligaments, my SI ligaments, SI joints, and the multifidi. Additionally, my left knee was injected with high-dose PRP into the meniscus, MCL, and ACL. The treatment plan following the procedure is, for the first 2 weeks, it's going to be very high levels of inflammation, so it's just the rest and recovery period where try not to do too much with your body, be taking... don't take any non-steroid NSAIDs and non-steroid anti-inflammatories, but you can take like muscle relaxers and pain pills as needed. You use the far infrared heating pad twice daily. Last procedure, they recommended the red light near infrared heating pad. This time they recommended the far infrared heating pad, and looking online, far infrared can travel 2 to 7 inches inside the body, whereas near infrared's only millimeters into the body. So this will promote blood flow all the way deeper near the disc level. Intermittent fasting is recommended, so I do a 8-hour window between 11 a.m. and 7 p.m. each day. The other 16 hours for each day I'm fasting. This is not recommended by the Regenexx, but I've been doing the Wim Hof breathing daily just to promote more blood oxygen in the body. So I know Wim Hof breathing oxygenates the body, and right now it's kind of a battle as far as keeping the cells alive. They have been grown in a hypoxic environment with very low to no oxygen, which is the disc. But anything to create more oxygen in the body is useful. 2 weeks out is when you can start doing water walking, which is really good for the knee as well. Less ground and pound, but still getting movement in. And then at 4 weeks is when you can start doing acupuncture, dry needling, cold laser, physical therapy, fascial work, and start slowly incorporating core strengthening exercises and just progress from there. So I'm really hoping for a lot better results this time around with a much higher dosage. So instead of 1 million stem cells in each disc, getting 17.5 million in my worst 2 discs. And the supporting ligaments and muscles such as the multifidi, supraspinous, intraspinous, and the transverse ligaments, along with the sacroiliac joints and ligaments, and the epidural space. Dr. Markle was able to reach the epidural through a safe triangle, which is below and above the nerve exit at each level. And that area can promote regeneration for the nerves as well as the disc. So it's beneficial in that regard. There's during our review of the MRI prior to the procedure, we were able to see that the T11T12 disc also has an annular tear. He was able to show me different views of the MRI that I haven't been able to see on my own. And the in that same area there in the thoracic lumbar junction, there's bone spurs, traction osteophytes, which have developed off the vertebrae there, which is probably causing part of my pain as well due to the high level inflammation. So the reason we did the left knee also at the PRP was, we targeted the ACL because based on my MRI, the ACL was a light color instead of a nice dark color, which would show a strong, healthy ACL. So the doctor had said that my ACL was sprained and was all my other ligaments and surrounding muscles were compensating and due to the instability. So he targeted the ACL, LCL, MCL, and meniscus with plasma to tighten up all those ligaments and strengthen them. So that'll be interesting to see how the PRP goes on the knee. It'll also be really interesting to see how 17.5 million stem cells goes compared to 1 million cells in those 2 discs. And then in my T11T12 disc, I look forward to seeing how the 20x super concentrated plasma goes in comparison to the 1 million cells from before, as well as in comparison to the 17.5 million cells we're doing on the other 2 discs this time around. So currently in a lot of pain from the procedure, but that is expected, and a lot is going on and taking place in my body. So I'm hoping for a really good result this time around, and I will certainly post more videos to update everyone on the progress. And I appreciate all your well wishes and watching the video. Thank you.